we talked right from the get-go about how conflicted, corrupted this national government was by their interest in private healthcare. When they brought on Lester Levy, he has been talking about the benefits of private healthcare for literal decades. So when he was put in charge of Health New Zealand, that was not ever going to be anything other than bad. I think you're 100% right that this is just trying to clear the wait list because the wait lists look bad. And I think it also ties into a narrative of our healthcare system as it stands just can't cope. It's just not good at it. The public system is no good, that we have to go to private to solve the problem. And then they do exactly what you're saying. They go, I'll have that one. That's nice and easy. That'll be quick. Yep, we'll do him, not you. Maybe you and money, please. But it's that whole narrative that public health can't do it. Parked outside Dunedin Hospital right now is something that I saw the other day and thought, this looks expensive. And I checked in. It is very expensive. It's a big fancy PET scanner truck that Mercy Hospital have purchased, custom built in the Netherlands for $7 million. And I'm sure they're going to get that paid off.
I might not have any problem with that if that 7 million was raised privately, you know, for the benefit of whatever, for their own use. But the reality is, where do you think this money for all these PET scanners and CTs and MRIs in private is coming from? It's coming from the diversion of desperately needed taxpayer monies, taxpayer funds to the private sector. Now, they say they're doing a service. You know, they say they're doing a service to the nation, treating these patients that need care. But if they're going to sell you that line, you have to be able to know if what you're getting is a good deal or if you're getting screwed as a nation. And because they operate in secrecy, right, commercially sensitive, that is just an abhorrent thing to me, that we would be spending taxpayer money and not knowing what we're getting. How much are they taking out as profit that patients will never see care from? How much are they charging? So this colleague at my hospital, David Bailey, said that he and his department could do these cases cheaply within the public system, and we're willing to, but we're not allowed to, right? For want of paying for a theater nurse. And so you have to just ask yourself, where is this money going, and why will no one tell us the truth about what the numbers are? So show us, this is my challenge to these private healthcare people, to Simeon really, because it's his baby, isn't it? Show us we're getting value for money. Show us the numbers. Tell us how many. So David said the numbers are tiny. The patients are cherry picked. They will only do the easiest of the easy cases. And in the grand scheme of things, this is just buffing the numbers up a little bit so they look a bit better at an enormous cost. What could our hospital have done with $50 million? Probably could have done a lot. Probably could have treated a huge number of patients that we now will not be able to. So yeah, it's messed up.
Yeah, so
messed up, Chewie.
What could that 50 million have done in the public sector? Sorry, hiring people to then be able to fill those gaps. I just want to say one more thing about Lester Levy as well, and this is no casting aspersions, but just to let us all know, people who aren't sort of involved around businesses and what they do, he has been, and I'm pretty sure there's no other Lester Levy's. So he has been, or is currently, a shareholder or a board or a director of 64 businesses, because that's how many are listed on the company's website that are either currently in his name or have previously been in his name. So even if they're not all medical, you can just see that man is soaking in the world of capitalism and private business.
Mm-hmm.
Yeah, he is a private profit generating machine. He is a force in New Zealand, and you know, he should be thanking the taxpayers for all of the money that they have inadvertently and unknowingly diverted towards his businesses over the year, without ever seeing the numbers and the data to back it up, because it's all a commercial secret and will remain so until we get a government willing to say, nope, this is full openness, full transparency. The books are there for you.